So, been in practice for 17 years, and I knew I was going to do upper cervical. There's no way that I wouldn't do upper cervical. I mean, just seeing that baby come back to life, I mean, that was going to be my technique. So, upper cervical has to do with the top bone in the spine, or what they call the craniocervical junction.
What is cervical?
It is the neck.
Okay.
Yes, that's the neck.
7 bones in your neck.
Seven bones in the neck, the cervical spine, correct. And so there's something called the craniocervical junction, or CCJ. And what that is it is the C0, which is the occiput, the very base of the skull. Then you have C1, which is the atlas. You know the atlas, don't you love it? It
She's
holds
wearing
up
it around her
whole
neck.
world. I know.
Yeah.
They call it the atlas because it holds up your whole world, which is your brain. And then the axis, which is just below it, which is C2. Now, part of that surrounds the brainstem. The brainstem controls many, many things. But if we kind of quantify it a little bit, break it down.
Including breathing, by the way. Okay.
Yeah. It controls all your respiration. It controls all your heart function, and it controls all your postural muscles. So, as a chiropractor, we're very concerned about posture. We're very concerned about postural muscles because it affects everything all the way down to your feet, really. So I evaluate that very, very, very specifically. We take precision films. We actually get vectors from those precision films. And we use an instrument called a Laney instrument. It's a handheld instrument that has a fine tip on it. And the atlas alignment is so gentle and so precise that people get up off the table after that adjustment and they go, is that it? Is that really it? And I go, yes, just wait till you see the differences. So, we really take our diagnostics really seriously at our office because, you want to make sure that you're as precise and gentle in that area because it does control so much. So I even took it a little further. After I was in practice for many years, a little over a decade, I decided that I wanted to take it a little further and get a diplomate. So now I have a diplomate of chiropractic and cranial cervical junction procedures.
How many hours does it take to get a diplomate?
It's a 300-hour program, 3 years. And that's why I want to now go into the head and neck division of our office and really focus on those patients that are sick and suffering with post-concussion syndrome, migraines, headaches, dizziness, vertigo, all those things that are kind of under that umbrella. You may not have had a head injury, but you could have some of these symptoms, but it's just one of those things that, we need to uncover. We need to peel that onion to find out why. Because that's the one thing that we find out in our office. Nobody is told why. Why do they have migraines? Oh, well, here's medication. Well, you don't have a migraine because you have lack of this medication in your bloodstream. All right. So what we do is we tell our patients why. Why do they have these things? And they look at me in bewilderment and they go, why haven't I heard this before? And I go, well, you have now, and that's all that counts. Welcome to our office.
Exactly right. Welcome to our censored world of
Yes.
truth and how the body actually works. It's phenomenal. Okay,
Yes.
so you have seen the experience in your own private life, even before becoming a chiropractor and then becoming a diplomate in this upper cervical technique to address this. But I want to make sure the world's open to this. You've all been lied to. This last weekend, 3 days worth, I was on stages and doing Q&As, and every single one of the speeches I would say, stop lying to us. Like, you're just flat out lying. You just told the truth, Dr. Taylor, that migraines are not caused by a deficiency in a drug. In fact, I actually asked the audience, true or false, people struggle with migraines because they have an Advil or Tylenol deficiency.
No.
And the whole place busted up laughing.
I know.
I know, isn't that funny? All of y'all know that's wrong and not true. Yet every time the migraine starts, you run and swallow Advil or Tylenol or Motrin or something to kill the pain. You believe there's some you act like there's a deficiency. This is a sign that there's a deficiency of a drug. No, it's not. But this is the lie you've been told, that you can just manage the drug symptom, and there is no known cause for your migraines. Or it's hereditary and there's nothing you can do about it. Well, the truth is that's a lie. So you can actually go and learn from other people like you who have actually spent more hours studying upper cervical, only specific techniques in chiropractic. More hours, actually. She said 300 hours. That's 300 more hours than they did research on COVID-19 vaccines before they started injecting humans around the world. She's done more research and time spent in practicums, which are actual hands-on testing to prove you know what you're doing in front of other certified licensed doctors, and then took a test and spent all 300 hours worth of flying for 3 years, once a month. That's longer time frame than all the research combined, and they've injected 5 billion people with an experimental drug that has never spent that much time being researched in humans. Isn't that amazing? You know more about this topic than what everyone's been injected with for the last 2.5 years. All right, so just to bring it back to speed, we got 2 minutes left in this segment. When we come back on the other side of this segment, she just mentioned that in her practice, she's been in practice for 17 years. She's about to open up a new center or division of her practice. It's going to have one singular focus. And this focus is in part being driven and guided in her to open because of a correlation she has found between long haulers' COVID symptoms and what medical diagnosis?
Post-concussion syndrome.
Post-concussion syndrome.
Yeah.
This is going to be a phenomenal conversation. So we're going to go through some of that research. We'll show some images and stuff on the other side of here. But I want you to answer a question in this last minute because people around the world are going to want to know where your practice is because they've got children that are crying, screaming, grandchildren, pre-K kids, whoever, teachers at schools are going to be like, what in the world? I've got kids that behave like this, children I see like this. What do we do for them? Is this upper cervical technique, can it actually be successfully applied to elderly?
Absolutely.
What about 18 to 64-year-olds?
Absolutely.
We know about babies. You already told that story. So all ages. What about newborns like day one?
Both my kids were adjusted within 7 hours of their birth.
That's awesome. I actually had a chiropractor in my room for the last 2 or 3 births of my 5 kids, and they were adjusted the moment the baby came out before they even left the room. That's how fast it was. So, yes, you can adjust these kids. It isn't scary. It's not dangerous. However, Johns Hopkins published in 2016 that over 250,000 people a year die in America from medical doctor error. It's the 3rd leading cause of death in America. If you go look at pharmadeathclock.com, it actually lists since January 1st of 2000, the exact number of people who have died from chemotherapy, medical doctor error, which is called iatrogenic. And you will not see a list of any of these causes of death from medicine. You won't see chiropractors on the list. It's pretty amazing. But they'll tell you we cause strokes, harm, fear, whatever. Remember, this segment was brought to you by Doc's Rival Defense. We'll be right back.